Hi everyone, good evening. Hello. I hope you all
Hello.
can hear me.
Hello, how are you?
I'm good, and you guys?
Yeah,
Good.
all is good.
Mm.
Okay. So guys, welcome to week 2 of our session. So if you guys have noticed, the class has been divided into 2 groups, which can accommodate us all for better participation in class. Okay.
Okay, it's clear.
Okay. So on this our session today, we'll have to do a crash course and a review, prioritization, delegation, and staff management. And then we do some practice questions on it as well. Following that, we'll discuss some questions you guys answered from the last class. Because notice there were some errors with one of the questions, or a few, and as well there was a question or a couple of questions most of you guys couldn't get it all correct. So I think we'll review that as well. And at the end of the day, we introduce our new topic for the following week. Our new course, like which will be about growth and development. I think the material has been sent to everyone. I think everyone can access the material right now.
Yes.
Okay, that's great. So, like I said, let's start with the prioritization, development, and delegation, because this this is what you most likely see predominantly in your exam. We talked last time here or in the exam, they're just trying to test if you are a safe nurse. Like that, they're testing you if you'll be able to practice as a safe entry level nurse. They're not testing for specialty or any special knowledge. And whatever we are discussing here is not something so new or some sort of rocket science. It's what we have been studying and what we have practiced as well as nurses. Okay.
Okay.
So on the prioritization, we are just trying to assess which patient or which client needs our aid the most. Okay. Which is the most important we are attending to, which is the most crucial or critical, right? Now, someone like you're triaging. You could say triaging, right? So in the prioritization or prioritizing, there are rules that you need to follow. And one of the rules will be unstable patients, they will always have a higher priority than stable patients. I think that we have mentioned, or we had mentioned that a couple of times during our last session, if you all can recall, right? And most patients which will be assigned to you as an LPN, they will be stable patients. So we are laying emphasis on this rule that unstable patients have more priority than stable patients, because the fact that you will be assigned a stable patient doesn't mean the condition of that patient cannot change at any point in time. So you should be able to notice a change in condition, and your course of action should fall within your scope of practice. Is that right? So the first rule, like I said, stable patients, they'll have less priority over unstable patients. And when we talk about unstable patients, what do we mean? We mean patients that are newly admitted, newly diagnosed with a condition, patients that have been post-op less than 12 hours, patients with acute change in their conditions, patients with abnormal vital signs, and the patients with unexpected findings. Okay. I don't know if we are all following. In the course of the class, you feel free to ask any question, or as I'm going through, you can stop me at any point, ask for any clarification. If there's any worry, you ask, you have to clarify before we continue. Okay. So, like I said, unstable patients. Who can give me examples of some unstable patients here?
Like a patient has a chest pain, sudden chest pain, or changing, has a confusion, sudden confusion. Also, maybe post-operative will increase the urine output in the first hour, less than 30 ml per hour. All this is unstable patient.
Thank you. I like the word you use, changing, which is very, very important.
We can we
Once,
can also we can also adding like massive bleeding patients, also septic shock patients,
right,
acute MI, respiratory failure, and so
exactly.
on.
That is excellent. The vocabulary is perfect. Acute, good. Changing, good. Unstable, good. Those are keywords you need to look for when you're taking the exams. If you find yourself with a question talking about prioritization, you need to look for those keywords. Once you find those keywords, you know those patients, they are unstable already, and they assume the utmost priority. So the RN must see these patients first, not the LPN. Don't get it confused, okay? The fact that you can identify them as unstable doesn't mean you can attend to them, right? If you remember, LPNs will be assigned to stable patients. So if you can distinguish between stable and unstable, you're on the safe side to know which task can be delegated to you and your scope of practice. Okay? So talking about stable patients, you have patients with expected findings, you have patients with chronic conditions, and you have patients that have been post-op greater than 12 hours, patients with no new changes, and patients that have been improving, or patients that are actually improving. Those are stable patients. And these, they can later be delegated to you. All right? Another rule in the prioritization, if we can recall the ABCs. Can we all recall the ABCs? Airways, breathing, circulation. Exactly. So which problems do we assess first?
Airway.
Okay. Followed with breathing, then circulation after that. But with this rule, not all, it does not apply like to all cases, the ABCs. Hmm? You can have a patient with like COPD. Let's take for example a patient with COPD and an oxygen saturation of let's say 92% with 90% with difficulty breathing, and you have a patient with like an active hemorrhage bleeding profusely from the central line. So in this aspect, which will you attend to first, or which will you seek? Which will you notify the RN, or which is most? Which of these has the highest priority?
The priority for the bleeding.
For the bleeding. For the patient has COPD, patient saturated 92 is accepted from this one from 88 to 92. So we'll go to the direct for circulation.
So that is excellent. So that is just what I was trying to like show you guys. Like the ABCs, they will not always apply to every case or in every case, right? So in this case, solve the problem of circulation first before even about the breathing. Okay on that. So another rule, you have always take priority over chronic conditions, right? Do we agree on that? Acute patients versus chronic patients. Once you're acute, your condition is unstable. Chronic, your condition is stable. It's been determined for a while. Is that correct? Are we following? Hello?
Sorry again.
Again, the question, please.
No, I am emphasizing on a point here. At acute patients will always have priority over chronic patients.
Acute patient unstable should be priority.
Yes.
Over chronic patients. Right? And another point is you have expected and unexpected findings. So if there's an unexpected finding, that takes a priority. Like post-op day 1, you have my pains, that is expected, right? For any patient, any post-op patient, my pain on day 1 is expected.
Right.
Oh yes. And going to delegation, I mean, this is where most students they actually lose marks. Okay, and for you to get this right, you need to understand your scope of practice very well. You need to know what you are allowed to do, what you can accept as an LPN, and what you can dedicate to a UCP as an LPN. Because as an LPN, you will be able to dedicate tasks to UCPs. Correct?
Okay, yes.
Yes. So the LPN role, you can give routine medications as an LPN. Okay, you can perform sterile procedures. This would depend on the hospital policies, the province you're working in, and the additional training. But most likely you will not encounter questions like this, which will require further clarifications from additional training hospital policies and the province you're working in, because the exam, it's somehow standardized. It's supposed to suit everybody. It doesn't matter where you are taking it from or where you be practicing. So another LPN role you will be able to perform is, like we said earlier, care for stable patients. And you cannot do initial teachings. You cannot take unstable patients. You cannot push IV medications. Okay? Can an LPN do teachings? Guys, can an LPN do teachings? Patient teaching.
No, LPN cannot do initial teaching for RN. Reinforced teaching.
Exactly. That is what I'm trying. That's what I'm just trying to assess here. An LPN, you will not be able to do the first teaching. You can reinforce, but you will not be able to do the first teachings. Pay attention. You will not be able to. You will not be able to start first IV lines. You will not be able to do the first teachings. You can an LPN change the wound dressing of a patient? Can an LPN do the wound dressing?
She can change dressing, sterile dressing, stoma dressing, big tube dressing, wound drain.
Yes, LPNs can do. They can change dressings, but they are not permitted to do the first dressing change
If
on
receive
post-op patients.
competency, they can do it.
Yes.
Yes, competency according for the place policies.
Yeah, according to the hospital policies and additional training if required.
So the first
So
change dressing, it will be by RN, and we will do the second. So that means that initial issues it will be with RN do first, and then we will just reinforce on.
exactly, Ibrahim. The RN does the initials of most cases. The initial teachings, initial changes, initial assessments. And the LPN, you reinforce teachings and you continue care. Exactly.
Yeah, it's clear. Thank you.
Okay, sure. So as an LPN, you can assign tasks or delegate tasks to UCPs. Some of these tasks will be like vital signs for stable patients. Okay. ADLS, activities of daily living, feeding, ambulating, and in the ambulating, can an LPN or a UCP ambulate a patient out of the post-op? Can an LPN or a UCP ambulate a post-op patient?
Post-op patient is unstable. LPN, this is only daily living stable the patient.
Thank you very much. That is great. Exactly. Post-op, less than 12 hours is unstable. So you cannot accept a task like this. So you can delegate feeding, bed bath, as well to UCPs. And you cannot delegate tasks like assessments, teaching, evaluation, or interpreting data to the UCP, or you as well as an LPN. Okay. So let's look at staff management. So this it takes leadership and professionalism while working in a hospital setting or whichever setting you find yourself in. So if a staff member makes a mistake, you don't ignore it. Or if you go into the exam and you find questions like, let's say, you encounter a colleague or you encounter an LPN during a night shift, changing like administering medication to a patient without checking the patient's ID, what do you do? And you often see options like ignore it, address, confront, take over, report to supervisor. In situations like that, you should never ignore any mistake. Never ignore it. So
I
most
want to ask
likely,
about. I'm sorry, I have to interrupt you. There is a question. You sent 20 a question before for like 30 minutes. One of question was like this. So I should speak to him or I shouldn't speak to him. I should inform the manager or just and I can talk to him, like speak to him, or no, I can't.
you can talk to him based on the you can talk to him based on the outcome or the effect of what your colleague is doing. Because if the procedure is directly affecting the care of the patient, if it's illegal and will affect the care of the patient, you confront directly. Okay? If
Okay.
it's illegal and it does not actually affect the care of the patient, like if you notice your colleague is hiding medications and narcotics, diverting narcotics, right? That is illegal, but it does not actually affect the safety of the patient because it's not a narcotic like prescribed to a particular patient at a point in time. With that, you will have to report. And if it's not illegal, but it's a breach of confidentiality or breach of conduct, you discuss with your colleague. Does that clear that?
Like if the question is giving medication without checking the ID band of the patient, I should talk to him or I should report. I can talk to him in this issue or no?
If your colleague is giving a medication without checking the ID band, you confront your colleague immediately. Guys, remember the five R's of medication administration.
Okay.
We do remember that, right? Right route, right patient, right route, right dose, right time.
Yeah, right date or
Yes,
time.
right patient, right
All
time, right name of the
those,
patient, name of medication.
all
Exactly.
this.
So if you find if you find yourself your colleague doing such a mistake, it's in your position to confront at that point.
So in this point, if I stop him and talk to him, I should report it too or no need?
You have to document.
Mm. Okay,
Okay.
okay. Thank you.
Yes.
Sorry, I have one question, please. In situation, if I heard two of my friends like talking about some personal information to a patient, and it's like a break, like the breach of confidentiality, so I can ignore it or reporting or what my situation is.
In that situation, you can meet your colleague afterwards and you enlighten the colleague that what he or she is saying is a breach of confidentiality and a breach of code of conduct. It does not directly harm the patient instantly, so you can meet your colleague afterwards. And if they still continue the behavior, you can take it up then. Is that clear?
Okay.
Yes.
Please, I have one question. There is two question in the first task we received. has a different answers with the answer model. And when you send the rationale models with the answer, you make another answers. Can I check this answer with you? It's for only 2 questions.
Okay, like I said earlier at the beginning of the class, we noticed that we had 2 questions with an error.
No, is one question is talking about the same, this one for confidentiality, breach of confidentiality. The question said a nurse is overhead calling a client difficult in the hallway. This represent actually the answer was breach of confidentiality and the professionalism. But with the answer model, it was professional communication.
Actually, the correct answer is breach of confidentiality.
صح, thank you. And the other one, it was the nurse documents an incident report. This report should be should the answer remain separate and used for quality improvement. For the answer model, be part of the client health record. This one is wrong. You make it in your model is remain separate and used for quality improvement. This one is the correct one, sir, right?
Yes,
Okay, thank you. I just to make sure from this answer.
that is it.
Thank you.
Okay. So back to what we're saying. If you are correcting an action which does not directly affect the patient's safety, you confront your colleague in private, you assess the understanding if your colleague actually understands the what he or she is doing, and you educate. If there is no change, then you can escalate. First, educate before escalate. Is that clear?
That's mean the answer for the question number 16 is
Can you read the question, please?
an LPN observes a colleague administering medication without checking the client's ID band. What is the most appropriate initial action?
Should be B.
Yeah, it should, according to his look, it's like speaking to him.
Speaking to him, it's written after the medication is administered. Yani the error is already occurred or took place.
The error has already.
It is not error. He didn't tell that he give the wrong medication. He gives
Yes.
the medication without checking
Checking.
ID. Actually, I can know the patient. It's already yani, in our work we know the patient will not checking ID because I know already the patient. I have one patient. It is
Okay,
wrong, but
what
but
about skipping the identification part? Just only communicating with my colleague or to be escalated?
That's why you confront in private and you educate.
Yani no
You
need
con-
for incident report or escalation or nursing manager to be aware of this.
no incident happened, no wrong incident happened. Nothing happened. Like
As
he
I
just give me-
understand, if you don't touch the safety of the patient, تمام, it's no need for report.
yeah, you can.
Maybe he knows the patient. Maybe you didn't notice that he checks the ID band well. Maybe just you need to take a comment first. Then if he is in the question, remind or make a point for any harm. Maybe like some question that someone make wrong position for the patient. خلاص, maybe the patient will be risk for fall or something. You should interfere fast and make report for additional education.
Thank you very much, Mohammed. That's a very good explicit explanation.
Great.
Sorry, I have an extra question, please.
Go on.
There is one question in the exam. A nurse is overheard calling a client difficult in the hallway. This represents constructive feedback, professional communication, breach of confidentiality and professionalism, acceptance, stress relief. I already chose breach of confidentiality,
Yes,
but
yes, this one I ask him now. He's the same one.
uh
هو مجاوبها صح في الراشونال مديول، بس في الانسر مديول هما اللي مجاوبينها غلط.
بالظبط صح كده
بس
تمام.
هو اكد لي ان الاجابه بتاعته هي اللي صح. breach
Okay,
of
sorry.
confidentiality is the one
Yeah,
correct. Mm.
yeah. Okay, thank you. Sorry for speaking in Arabic. Now it's clear.
Mm.
It's okay.
Thank
It's
you.
okay.
Thank you.
So, if a patient complains about a staff member, right? Your correct answer or response should be like, you should assess more. Ask the patient to tell you more about what happened. You should never defend the staff, agree with the patient, or put blames. Okay? And when floating to another unit, you can only be assigned to tasks within your competency. I still reiterate, stable patients. You will be assigned to stable patients. And you'll be assigned to similar skills. Like you'll be assigned to patients with conditions that you can manage based on your skills. And you should never be assigned full responsibility to unfamiliar specialty care. Like I said earlier, the exams you are taking are testing for safe entry-level nurses, safe entry-level LPNs, not specialty, right?
Okay.
Mm.
I think if you can share your screen, it will be better for all, if you don't mind for that.
I mean, every information is available on the platform.
I know. I
Okay.
know. I say that it will be better for us for discussing something like that, to be more focusing, if you don't mind for that. But if you want to compete like that, it's okay for me, no issue.
Oh, okay. You mean like I should? Okay, I get you. So I'll probably do a PowerPoint. I will do a PowerPoint presentation, and I will upload to the class. Yeah, I'll upload to the classwork that you can access as well too.
Okay, thank you. It will much appreciated. Thank you.
Okay. So if the question says, which patient can nurse assign to LPN, right? If your picks, I mean, what should be your picks? Can I get a response?
We said for LPN, better is the most stable patient.
Okay. Patients which are stable, patients that are not on new medications, patients that are not on new diagnosis, right?
Yes.
Patients
Yes.
that don't require complex teachings.
Yeah. Post-operative patient. Maybe after 2 days post-operative, it's stable. Also, you can sign for this one.
With post-op patients, yes, 12 hours in 12 hours.
Yes.
Yes. And if it says which task can be delegated to a UCP, what would be your suggestions?
Like ambulation, like feeding patient, also changing mattress, changing bed for patient bed like that. Something not related to medical tasks or delegation tasks like that.
Good.
Yeah,
Like you said
should the
earlier,
active daily living, should vital signs mobilize the patient, drain and intake urine output, change position.
okay, Amar, can this happen? Can they take the vital signs of a patient for a patient who just came in complaining about chest pain radiating to the arm, to the
No,
left shoulder?
No, for
This
stable
unstable
patient
patient.
only.
no.
Sorry.
We'll take the vital signs only for non-risky patient
Good.
with no high risk for any risk like chest pain, anything. This one it will be assigned for us, not for them, only for stable patient.
We
Good.
will assign like with expected outcomes, you know.
Yes, you assign patients with expected outcomes. Like Ibrahim said, patients with expected outcomes. Okay. I know most of you might be able to deduce what can be happening, like give a prognosis based on how you have been practicing before previously as RNs. But then once you change the designation, the scope of practice changes. So you should not let your ego get in the way. Like, I can do this, I could actually do this. What is the difference? Right?
Yes.
You should, yeah, stay within the scope. So in management of care, the priority orders are, like we said, airways, breathing, circulation. The ABCs, you should also take note that they don't always work in all situations, like we mentioned earlier, and you guys actually stated it very well. As well, safety, acute before chronic, unstable before stable, unexpected before expected outcomes, and nursing judgment stays with the RN, not with the LPN. As an LPN, you do not do initial assessments. Good.
Yes.
So in this thing, if we are all confident with this crash course, I think we can have a few questions just to test our understanding of what we have been saying so far. Okay, let me try to share my screen so you guys can access. Okay. I don't know if you guys can access my screen right now.
Yes, it's clear.
Okay. So let's look at some of these sample questions. Like question 1, an LPN is working a night shift on a medical unit and is responsible for 6 clients. At 0200, the LPN receives the following report from the UCP simultaneously. Which client requires the LPN's immediate assessment? Which will require your immediate attention? 1 is a 62-year-old with COPD whose oxygen saturation has dropped from 94 to 91 liters. 2. Who can give me the answer to this?
B.
It is very opposite of one degree system student output past 4 hours. Another answer, another last
B or D? Sorry.
another suggestion.
D. I think
The answer
I
is
think
C.
D.
I think D.
D.
D. Oh, B score is high.
No, C.
C.
This C. Increase this is the C
Oh,
for increase the weight for heart failure and that will increase the short-term
This,
breathing. The patient this is
life
the
threatening.
pulmonary.
yes.
Right,
Life
left side
threatening.
heart failure. This is priority.
For ABC.
This life threatening due to
Yes.
shortness of breath at rest.
ABCs, guys. ABCs,
ABCs.
guys. ABCs.
Yes.
Right?
C.
This takes priority, right?
Right. Yes.
Yes. So question 2. An LPN is in charge, is the charge nurse on a 20-bed long-term care unit. Staffing tonight includes the LPN, one RPN, and 2 UCPs. The resident is found unresponsive. The LPN initiates the emergency response. Once the emergency teams arrive, which action reflects the LPN's best use of the remaining staff? We talked about delegation. Guys.
Please, you can share your screen so I can see which question we answer now.
Sorry.
Please share your screen
Yes,
so I can see.
I'm actually sharing my screen right now.
No, I didn't see any screen. Any question?
No, we are. Maybe something wrong with your internet, but we already see now the screen.
We will try again.
Let me try sharing again. You guys have access to it, right? Can you see my screen?
Yeah. Yes.
It's already shared the screen.
Can everybody see my screen?
Yes.
Yes.
Okay, guys. So let's look at the second question.
Okay, now up your sign.
Let's look at the second question.
B. It will be B.
Well, we use suggest
B.
B. Okay.
B.
I hope we are all on the same page with the reason why it's B. Can we give a justification for our answer?
It will distribution the task according for the scope.
Exactly. That's excellent. You assign the task according to the scope and competence of the staffs, right?
Yes.
So the third question. An LPN is delegating wound care to a UCP for a stable chronic venous leg ulcer. The UCP has performed completely for 3 weeks. During today's dressing change, the UCP calls the LPN to report the wound appears larger, has new yellow exudate, and the client says it smells different. What is the LPN's most appropriate response?
Letter C. The signs of infection.
Number
This is
C.
new yellow executed, and the client says this is a smile different. This is signs of infection should be assigned, should be assessed. Letter C.
Exactly. It's excellent. I'm really happy you guys are following up so well. Question 4. An LPN working in a complex continuing care unit receives 4 orders at the start of a shift. Which consequence reflects the correct prioritization for first to last? Prioritization for first to last. The first.
B.
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 Excellent.
It will be B.
Yes, right, B.
Excellent.
Yeah.
Excellent. Excellent. I'm really happy you guys are following up. I think you have the confidence to even take the exams tomorrow.
Thank you.
Inshallah. Thank you.
So, the question 5. An LPN is the most senior staff member present when a client collapses in a community health center waiting room. A physician is not on site. The LPN determines the client is in cardiac arrest after calling 911 and initiating CPR. Which action best reflects the LPN's professional responsibility?
B.
It's a B because it's the senior.
Sorry?
B.
B,
the
B,
answer.
B, coordinate.
So why will you say the answer is B?
B.
Can I have your rationale?
Coordinated bystanders to take the
I think it will be C
This is
according for the
Card,
scope of
yeah,
work.
card one month
She will start only for basic life support, not only for AD.
Like you said earlier, B.
no B.
Yes. Coordinated by
I
standards.
think B.
Yes. Coordinate.
Their coordinator for CPR, we cannot interrupt it for anything, only return for every 2 minutes for compression.
Remember, the LPN is the only medical personnel available.
Mm.
Right?
Yes.
Yes,
So,
okay.
question 6. An LPN notices a colleague has made repeated medication documentation error over 2 weeks, including late entries and omissions. The colleague confides they are struggling personally and asks the LPNs not to report. What is the most ethically and professionally appropriate response?
C,
She must report.
C should buzz the report. This is the patient safety.
Yes.
It's B.
I get your answers and your rationales. Remember, there's no wrong answers as long as you can back it with a good rationale. That's what we are discussing right now. So let me get your rationales, your reasons for it.
Already repeated the error over 2 weeks. We cannot speaking together kindly. Should be report.
No, it will be B. You will talk and you will report.
If you guys can recall from our previous slide, not from the previous explanation, I said you meet your colleague in private, right? You assess, and then you report, right?
Yes, right. It will be
Yes,
most of
yes.
Yes. So you acknowledge the colleague's distress, you educate, right? As you explain the obligations, require reporting the pattern to the charge nurse or manager. Are we okay on this?
No, just a colleague, etc.
Are we confident with that?
Yes.
Okay.
B.
Okay.
Yes, B.
So we have question 7. An LPN is caring for an 82 years old with moderate dementia admitted for hip fracture repair. On post-op day 2, the client is increasingly confused, attempting to climb out of bed and pulling at their IV. We have the vitals, temperatures, can read through. What is the LPN's priority action? Remember, this is the giveaway, your priority.
C is for sepsis.
This C.
Sorry?
Unstable patient. C.
Yes, let's go for sepsis. Sepsis.
Signs of sepsis, patient hyperthermia, hypotensive, tachycardia, hypotensive, DSAT.
Great. I'm so
A.
so
The answer C?
Yes, so you go for septic shock.
You recommend yes. So what are the signs of sepsis? Like sepsis presentation.
Feverish, tachycardia, hypotensive, desaturation.
Exactly. It gives it away already. Right?
Yes.
Yes. So question 8. An LPN is asked by a nurse manager to perform a task not practiced since clinical placement 3 years ago. The manager states the unit is so short-staffed and no one else is available. What should the LPN do?
C.
C.
C. She must
C.
clarify. Clearly
Exactly.
communicate.
You should never accept the task you are not confident. You're not confident in performing. Is that right? Never accept or take on a task you are not confident in performing.
Verse 8, 9. And preparing it one.
So question 9. An LPN is preparing to administer blood before hanging the unit of blood red blood cells. Which sequence of verification steps is correct according to the safe transfusion practice in Canada? Who can recall the transfusion protocols? Can we recall?
The blood bank is confirm client ended. I think A.
Is right.
Number A.
Yeah.
A. Check the patient the first one,
Yes.
check the patient identically corrected, check the patient physician order, check compatibility for the
Physician
blood,
order.
start with vital signs before the hang.
Exactly.
Yes.
Those are transfusion protocols.
Daniel Bean is working in the first.
Are we on question 10?
Okay. A.
What could be the reason for your A answer?
If not contraindicated with emergency.
I think as a home intervention, it will be A.
Yes, yes.
Yes, for
Because it is written
aspirin,
here,
for
if not
initial dose.
contraindicated.
Yes, for initial dose, it will be accepted from home.
Yes, and also activate emergency system must be
Yes, we'll follow up.
the
Yes,
priority. Yeah.
to wait the help to come.
That's excellent. So you guys can notice in taking the exams, if you pay attention, close attention, the answers are most likely being repeated in the questions as well.
Yes.
Right?
Sure, yeah.
It's around about the scope of service, the ABC, the assessment for the patient.
Priority.
Exactly.
Yeah.
So the answer will be A, اللي هو administer ASA.
Yes.
Thank you.
Mr. Aspirin, if not contraindicated. This is very important. If not contraindicated, and you activate emergency transport immediately.
Sure. Thank you.
Patient 11. An LPN is caring for a client who is a Jehovah's Witness and has a previously signed advance directive. Guys, do we have a clear knowledge on advance directive? I hope we do, right? Do we?
Sorry, your screen is off, I think.
It's off?
No, it's clear.
Yes.
Can you guys access my screen? Hello? Do you guys see my screen?
Yes, we can see.
Yes, it's clear, yeah.
I think the answer will be C.
Uphold the valid advance.
As a respect of the autonomy value.
Exactly.
Yeah, because he refused already. Even if he is unconscious, we can't give him.
This is it already.
Administer, yeah.
Previously signed advance directive. Yes, it's signed already.
Yeah.
Okay.
Yeah.
Question 12. An LPN suspects that a newly hired agency nurse on the unit is impaired by substances during their shift. The agency nurse has administered 2 medications in the past hour. What is the most appropriate course of action?
See?
For the child
Or nurse manager? The agency nurse for Allah خط بعيد.
I think the answer will be C, as you cannot confront يعني an employee under substance abuse.
Do we have another suggestion?
From direct clinic.
D.
لا end of results لا ask this Johnson nurses paper and
Why can I get a reason for your answer being D?
I cannot confront because he is under يعني substance abuse. I should report directly.
Any more suggestions?
C.
Guys. Like I said earlier,
yes
right?
yeah
What
we did see from the
it
beginning
causes, if something is
Written
directly
here.
causing harm to the patient, what do you do immediately?
yes immediately notify the charge nurse
Immediately, I will ask her to go. B.
Yes,
yeah
exactly.
Yes. She is not a
Right. Patient safety.
yes,
Patient
not for
safety, patient safety is a priority. Remove the agency nurse from direct client care. Right?
Yeah.
Exactly.
يعني the answer will be C.
Yes.
يعني I will not confront.
Immediately.
No, we can't say privately. We
Hmm.
can't use this. Yeah, we can't use this action. Yeah.
Yes, it's directly causing harm to the patient now. Patient safety is a priority, right?
Yes.
So you remove the agency nurse from direct client care immediately.
And during any mistakes, we can't talk privately to the nurse.
Yes.
Yeah.
So question 13. Using a Canadian trash and acuity scale, which client should be seen just in the working clinic?
Blood pressure, no. Sudden severe headache described.
C.
The working clinic.
C.
C.
Okay.
C.
Because the
Severe headache.
severe headache
Hypertensive.
described as the worst of their life.
Correct
Because
C.
we know about the complication about of the severe headache.
Calm down.
Yes.
Correct is C.
Yeah.
Yes.
Severe headache. What is severe headache? It's not why C.
Look, read the answer again. If it's heavy or with a sudden onset. Acute beats, chronic. Guys, remember the rule. This is an acute onset, sudden. Right? Guys, are we following?
I'm following.
Yes.
But yani, just to give us a chance to read the question because everyone is answering like we are in a race. Let us to answer.
Sorry,
to
my
read.
apologies.
We are. This is not an exam.
Yeah,
We're just reading. Let us to read yani, the question and the answer.
the answer is just a discussion, okay?
Okay, but I can't finish the answers and you answer and you go to the next question. Please no one answer until we all read the question and the answer.
Okay.
Okay, thank you.
Sorry.
We said severe headache because it is maybe lead to stroke or hemorrhage.
Ibrahim, are we clear on that?
No problem. We can wait. We can give them a chance to read the question and answer. It's okay.
Can we move to question 14? So let's do question 14. And LPN reviews, okay? Guys, can we take 2 minutes?
I think
Brother,
the answer
please,
is
I need
Click B.
to ask for something.
Click B.
Okay, is B? I think is B.
B.
I need to ask for
Okay,
something.
B.
Why
Okay.
What's the question?
should be we the one read the question and take a long time to check the result? Should be you the one explain for us the question and answer correct answer.
That's not
We
right.
not right?
Sorry.
Yes, this make like
We are an open discussion.
critical
We only
thinking
will
and
take
make us
maximum
what
10 question in all this time. Should
He's
be
giving
the
us the
one
time to understand.
read the question and answer
You can
and
read it.
inform us the correct answer. We set only more than 1 hour, around maximum 10 or 15 question.
Yes, but we discuss about the rationale and about the idea of the question, not only giving one answer.
He the one should be inform us, explain the question and the correct answer.
No, he
He
is giving
discussed
us
with
a
us.
chance to
Yes.
understand.
I'm giving you guys a chance to understand the rationales. That is why we are trying to. We are not rushing through questions to get correct answers. You can get correct answer without understanding why the answers are correct. Okay.
Okay, you the one should be explain
No,
for
he's
us
not.
for rationale.
So
It's
are we on
okay
question
if you
40?
have any question and you don't understand, you can ask one and twice. It's your right also.
Okay,
Is there a question you don't understand?
you are accepted to take 1 hour 1:30 hour to just we discuss together.
Yes,
I
we
think
accept.
the most
Yes,
important
if
thing is
we'll
for us to
find a good explanation for the question and we know the idea about the question, not only the answer for one question, and it will be better. Yani, if the same question come in the different way, you will know how to
You
answer, not
understand.
only this answer for this question.
Exactly.
It's
Are we
about
on the same page?
understanding, not about the correct
Understanding.
answer.
Also this way can make some sense for us. But if like he said the correct answer with rationale and continue,
now
this
discuss.
will not cannot make sense for us.
Yes,
Yes.
if I just read through the question and tell you the answer is B and we go to the next, what purpose
I
does
am
that
not
serve?
I am not say you just inform me for correct answer. I said
Okay.
we need you explain.
He is explaining.
Okay.
He
We need
explaining
explain from
after
you.
he already explained
He's
after we finish the
explaining.
answer.
Okay,
But
you
for
accept
is there,
reading
as you
but
like.
for reading the question, we should read by ourselves. I think that.
Yalla,
is
let's
there a
let's
question
continue.
is there a question you don't understand, like you want me to clarify for you? Because like I said in the beginning, as we are looking through it, if you have any question you do not understand, or if we get to a point where you are confused, you are free. I mean, you should stop me at any point and ask.
If we all everyone said different answer, so all discuss together. خلاص, I have now interruption and I am not check good answering. After you answer finally the correct answer, خلاص, already I have interruption. I can't accept.
I think there is misunderstanding, Miss Marwa.
يا جماعة احنا ممكن نمسك العصاية من النص، مش شرط يعني.
After that, if we make a mistake, he will correct.
يا جماعة احنا
Yes.
نمسك العصاية من النص، هو يشرح بس يهدى شوية في الريتم وما يجريش في الأسئلة والإجابات لحد ما نفهم وخلاص. يبقى احنا كده مسكنا العصاية من النص، لا أنت غلط ولا هي غلط.
هو ممتاز النقطة دي يا أستاذنا، بس دلوقتي النقطة احنا عايزينها، احنا دلوقتي الميتنج الجاي يعرفنا هو هيجاوب ايه بحيث نحضره نبقى معاه برضه في الموضوع، مش كده بنخش نلاقي الأسئلة ونحل وخلاص. ده اللي أنا أعرفه إن احنا هنذاكر مثلا كذا، والله البتنجان جاوب كذا، يبقى ده
انا
الافضل
معاك
لنا
انا
كلنا، بدل ما احنا كنا
Uh,
لا لا
كونفيوز
يا جماعه،
حرفيا. والله
الراجل
انا قاعد
راجل مش بيتكلم عربي، فلو انا اتكلم بس انجليزي
oh
معاه
yes,
Guys,
yes,
عشان
guys,
please speak in English,
guys,
please.
guys,
Yeah.
please. I'm
سوري
taking
for interruption Virginia.
okay. I'm taking this time to explain to explain the answers and the questions so that you can actually understand the principles and not the answers. The principles are very important. You are supposed to know why it is the right answer, which principle they are testing for.
Okay, please, I have one question, please.
Please go on.
Okay. In next meeting, please tell us what you will explain so we can prepare it, so we can know what will we do. So we can be with you in the question and we are ready. Not like now, I am very confused. I didn't know. Now if I read the question, you get the answer.
Save
Okay.
more time.
What
Save
is
more
the
time,
benefit for
Mr.
me?
Virginan.
Nothing. Just listening.
Sorry.
I'm ready. Okay. Fatih, you can go on.
Sorry, Mr. Virginan. Can I say something?
Yes, please.
Okay. Yeah, really, from the beginning, we are expected that the lectures will not be like this because, as a lot of colleagues in the meeting know what I am saying, we took already a NCLEX, and we started with the lectures in the beginning. Then, after finishing the lectures, we can take exams like UWorld or Archer. So we can start with the lectures first. You start to for discussion about the lectures. Later on, the questions will be our rule. I don't know if this is suitable for the others or not, because this is my expectations from the beginning.
Okay,
really.
okay.
To explain, because this questions, it is not specific for one topic. It is not specific for example, a cardio. So I will study the cardiology, then come this lecture to answer the questions about the cardiology. Do you understand me? So it is better to explain the lectures for us, for all of us. Then let these questions or exams, we can practice it privately, separately, at home, because this makes it questions, and not all of us aware of the answers.
Okay, Fatih, can I
This
say?
is my opinion, and I don't know that.
Hello.
Sorry for interfere, Mr. Virginia, Miss Ines, for this one. Actually, this practice is for preparing for all the exam, not only for one topic, two topic, and even for the platform, even for the lecture, even for the exams they shared before, you will find the questions from different scenarios, different topics. تمام, not even the same one we studies in the class, this classroom or the platform for the website. Even it's different, but it's making like the real exam that you will go inside. You will not find only one scenario, two scenario. You will find all together. It will make your critical thinking it will be more high. That you will thinking and studying more, more than one topic in one time, and you will collect more information also about the idea about the class and about the exam itself. I don't know,
Mr. Dear,
but it
Mr.
will
Dear,
be better for us. And
yes, I
for
know.
the next 10 weeks, if we will take like this, we'll take more questions, تمام, about the real exam, not only about the topics. Maybe almost of
Mr.
us
Dear,
know about the topics
it
specific.
is not now. Not now. We are in the beginning. This is the second lecture. This will not be easy for all of us. For me, alhamdulillah, it is easy because I took already the NCLEX. But I think, and I noticed that my colleagues, they can't read the question.
Miss Ines,
Some of them,
Miss
yes.
Ines, please, I'm sorry, I respect you too much, but please talk about only yourself. If you understand what he is doing now. So just mute the mic and let us complete the
Sorry,
lecture.
sorry, you can give the mic to Virginan. Virginan, please
Yes.
go ahead.
For me, I find
this
this so
man.
too good lecture and let him to complete. And if you have necklace and whatever you have, we don't have this. We are different.
Guys,
No,
guys,
no,
can
no,
I?
no.
Sorry,
There,
sorry,
there,
sorry, sorry,
there
sorry.
is
Look for
Virginan,
yourself.
please.
misunderstanding.
Don't talk for us. Don't talk for us.
There is
Virginan, please,
misunderstanding. I am
please,
talking
please,
about the others, not me.
Guys,
please take the mic.
Hey, don't talk
Please
for
take the
anyone.
mic.
Everyone can talk for himself. Okay.
guys, please. Can I add something? Hello.
Yes, go ahead.
Yes. The reason I was taking these few questions, it was just to test our knowledge on what we discussed earlier about prioritization, staff management, and delegation, right? It's not like we are testing on the complete exams right now. The only reason I was trying for us to take these questions is because of what we discussed. From what I'm trying to do is like, after we treat something or after we talk about something, we should answer questions pertinent to it so that it can better stick to our understanding. Okay? Does that make sense to?
Yes, you can continue. You can continue.
Oh, you guys, you might have preferred complete lectures, a 1 hour lecture without any question, and you all go privately and you answer the questions. Which is more preferable? Because I think lectures alongside with questions, they make you understand the principle more, right?
Right.
Yes.
Can you continue, Mr. Virgin?
I think we'll do this question 14 and 15, and then we continue with the growth and development, a brief lecture on growth and development. So, question 14, an LPN reviews ANR and notices a colleague administered 10 units of regular insulin instead of the ordered 1 unit due to decimal point error. The client's current blood glucose is 6.1 millimeters per liter, and the error occurred 45 minutes ago without being reported. What should the LPN do first? A. Complete an incident report before taking any other action. B. Assess the client immediately for signs and symptoms of hypoglycemia and notify a physician. C. Speak with colleague about reporting the error themselves. D. Administer oral glucose prophylactically since hypoglycemia is likely. You guys might, can I say something? You guys might think this question is based on the medication administration and glucose intake, but the principle they are testing here is about safety, priority. The priority action you're supposed to take first, right? Which is what we just discussed earlier. What are you going to do immediately to save a patient?
Assess the patient يعني immediately for signs and symptoms of hypoglycemia.
Should be assess the first before any action.
Exactly. So, last question 15. An LPN is working on an inpatient psychiatry unit. A voluntary client with schizophrenia states they feel better and no longer want their antipsychotic medications. The treatment team disagree. What is the LPN's role? These questions you guys might see and think of it as a psych question, but the principle they're testing here, it's about advocating for your patient. Do you guys understand me now?
I think C.
C.
C, it will be C.
Yes. Because you explore the client's reason for refusal, provide education about the risks of non-adherence, and communicate findings to RN, physician, and document the refusal. Right?
Yes.
Good. So let's look at growth and development. I think we all have the material which was made available to us, and it's in the Google Classroom. Can we check on it? Guys, are we there? Or should I share my screen again?
We can't see the screen.
Yes.
Okay.
Yes. About our lecture for today, which is the patient care across the lifespan. So we all know about the lifespan from infancy to adulthood and geriatrics. Like we said earlier, there's nothing we are saying here which is something new. We have all studied this and we have all been practicing. So also we are aware of it. We are just reiterating and instilling the principles, making sure we can take the exam confidently. Right? So like it stated, infancy and toddlerhood, which is characterized from ages 0 to 3. And from the first 6 months of birth, the expected milestones you are supposed to see will be a child to sit without support. And this indicates normal gross motor development and trunk control. So if you encounter a pediatric client who cannot reach these milestones, it's already an indication of a problem. That is just what we are trying to teach here right now, for you to spot abnormal findings, right? We all know 12 to 24 months, they are supposed to work independently and demonstrate progression in gross motor skills and coordination. A 24 months old that is unable to walk, it's already a problem, and we are supposed to notify the pediatrician, right? 24 months, they're supposed to use 2-word sentences, and they mark key steps in language development. Okay. And in the primitive reflexes, can someone give me some reflexes in the infancy and like infancy and toddlerhood? Sucking reflex, motor reflex, routine, like we can all record that, right? Hello?
Yes.
Are you guys following?
Yes.
Yes. These are some of the reflexes, like routine and palmar reflexes, which are supposed to disappear in 4 to 6 months. So if you have a pediatric client, an 8 or 12 months pediatric client still expressing routine reflexes, it's a problem it's a neurological problem already. Okay. These are just us. Yeah, this is just for us being able to spot these abnormal findings. And the next we have school age childhood, which is from 4 to 10. Children like this, they exert a lot of physical activities. So we are supposed to encourage proper nutrition, autonomy, and support. So and promote weight-bearing exercise, which can stimulate formation and increase bone minerals density during this critical growth phase. And then we have the adolescence, that is the teenagehood, and it's characterized by identity and transition, or identity versus confusion. In this category, you have teenagers who are confused they don't know who they are. They're trying to find their identity. So our role is to redirect them. And in this age, it comes with a lot of hormonal changes, which will be leading to oil skin and acne. I mean, it distorts their identity and brings down their self-esteem. So we can come in to do positive reinforcement and encourage them that it's just a normal cycle of life, which will continue as well. The next, we have adulthood and geriatrics. In this, we are mostly dealing with patients, and some of us, we might encounter clients, or some of us might find ourselves working in the nursing homes or long-term care facilities. We all understand that with adulthood and geriatrics, you have decline in short-term memory, slower processing time, and you have decrease in muscle strength and bone density, and there's an increased risk in fall. And if your client is bedridden, you have an increased risk in pressure ulcers as well. So what would be our nursing interventions? 4 preventions. The area should be clear of obstructions. If your client is bedridden, you should be able to reposition every after 2 hours to avoid pressure ulcers. If your client is mobile, you encourage regular low impact exercises to maintain strength and bone density. Okay.
Okay.
I think this is the introduction to the material we have to cover for week 2, and the material is being provided to us. It's in the Google Classroom, so from tomorrow we can have access to it. We answer the questions, and you guys will submit. I will check on it as well, and the next week we can discuss on it. Right? If there are any questions, you guys can ask or you email at any point in time. Is that okay?
Okay.
Do we have any questions?
Thank you.
Thank you.
Thank you.
Thank you, brother.
Okay. So see you guys next week. Okay.
See you. Bye bye.